This is the roundtable on preventing family separation, the key findings. And we're here to discuss the research conducted by our friends at the Know-How Center at the New Bulgaria University. We're actually going to have about an hour and a half together. So make sure you have something to drink, something to take notes on. We really want to hear your ideas and your feedback. We're going to start the presentation in a couple of minutes and then move into the discussion portion of what we're going to be doing. So if you can take a couple of minutes and introduce yourselves in the chat, right? Your name, the organization that you're with, where you're joining from. And I see Delia's here with Tanya's Dream Fund. Welcome. And Emily, good morning, Emily. I know it's early for the Americans that are joining. Okay, so before we start and have fun over in South Africa, people from Mosaic, I wanted to invite everyone to become members of the Thrive Collective if you're not. This is a global community that exists to eliminate isolation in orphan care. Members of the Thrive Collective have access to connections, trainings, and resources they need to elevate the way they care for orphans and vulnerable children. And A Child's Hope is going to send out a little bit more information about that in the follow-up email. If you could just stick your name, your organization, and your role in the chat, that would be great for us. Thank you. Sydney, why don't you go ahead, if you have them sent over to South Africa, if you wanted to introduce yourself, and then Elitza and Tony.
Yes, so my name is Sydney Parker. I am the Program's Partner Relationship Manager at A Child's Hope Foundation. So I get to work with the collaborative partners that we have who put on these events, and I love it. I've been with A Child's Hope for almost a year, and it has been an amazing opportunity. So I'm excited to be here with you guys this morning and to learn more about what's happening and everything going on in Bulgaria.
Welcome. Welcome, Sydney. Thanks so much for taking care of us and doing all the technology and everything like that. We're thrilled this morning to have Dr. Tony Matejeva and Elitza Lingorski with us. Tony's an intellectual powerhouse with a heart of gold. She'll introduce herself, and then Elitza with the Know-How Center. Go ahead, Tony, and take it away.
Thank you. Thank you. My name is Antoinette Mateva, and I'm part of the Know-How Center for Children and Families. That is part of New Bulgarian University. And this is the research center that is part of the coalition, which research we will discuss today. I am a clinical social worker as a profession, and also researcher and program evaluator, coach, and clinical supervisor. These many and different activities are engaged and focused on working with children and families, and also organizations in the healthcare, mental health care, specifically education, and also, of course, in social work. Elitza?
Yeah, hi there, everybody. I'm very excited to be here today. I'm Elitza Lingorski, also with the Know-How Center for Alternative Care for Children at New Bulgarian University. I am a communicator and a designer, and also recently graduated from an MA course in social work, in psychosocial interventions for children and families. So I'm combining the two now, and I'm very excited to share with you. We will be both together with Tony. Will be very excited to share with you our findings and recommendations from this research project, and I will also be very happy to host our discussion after we hear from Tony.
Okay. So first we will have a little presentation. It's actually this kind of webinar that we have today is second part of the discussion and presentation of this research that our coalition Childhood 2025 made. I see here Buriana Klimentova from Hope and Homes, that is also part of the research team. It's wonderful that you're here, Buriana. And in the previous webinar, we presented the data from this collective effort. But shortly, I will tell something about this. And after that, we will focus on the recommendations given by the specialists. And we will discuss around this after this presentation what are things that surprised you most, what are your experience and thinking that you can share about recommendations related to the topic of prevention of separation of children at risk from their families. This is the main topic of the research. It took about 2 years for us to collect data, first from the specialists from our coalition 2025, that is devoted to the deinstitutionalization process. In this coalition, there are active civic organizations that are running a lot of services for prevention and active work with children in most risks, in different risks, and prevention of separation of these children. So that's why we decided in our coalition this very important topic of separation and how it happened in Bulgaria to study first from the specialists in the field that we are part of. And after that, we made several focus groups in different regions in the country with other specialists that are in the daycare center, in the centers for residential centers, psychologists, clinical social workers, pedagogists. We collected data from them and we received a lot of recommendations. Part of these recommendations are focused on the policy and how generally to work on this, and the others are focused on how to work with the client, with the children and their parents. So I will make now a presentation. I will share this presentation that Elitsa beautifully organized. You will see this. Do you see this now?
It's coming online, I think.
Okay. Okay, so I will enlarge this. Good. So preventing family separation in Bulgaria is the name of the research. And we will see on the recommendations. First, the recommendation is that separation prevention is not yet sufficiently acknowledged and has to be, because all the efforts of the specialists are focused on real risks and how to prevent child from further risks. So they are usually take children from their families, and they live in specific places, but the agenda of the organization is slightly related to preventing even these acts of separation. Separation occurs when the families does not have supportive environment. This is what the finding of our research is. And we saw that poverty and a lack of supportive environment for some of the families leads to this separation. That's why we think, the people recommend activities that are taken by the social system to be organized around larger focus on the poverty of these children and families, and together with the municipalities, together with the other systems, to try to create supportive network and to create multi-sectoral teams that work on each of the cases. This is very important to this first level prevention to happen, and after that to work on the secondary prevention of further risk for the child. What we found is that if we early pay attention to what happens in some of the very poor families, and we try to support parents, we can prevent taking children from their families. So focus on the parents, focus on the family as a system is one of the first recommendations for the prevention, for the first level of prevention. Second finding is that we have a lack of sufficient data that make the system inefficient, because we try to search for a lot of data, and we know from the services that a lot of data are given to the system, but the system doesn't operate with them in a way to analyze this data and to put them for the further development of the policy. Usually data are collected in order to control the services, their quality of work, but it stops there. And there are a lot of important data that are not still there, are not collected, and we need a lot of thinking on this, how to collect sufficient data and data that change policy and practices, not just to control the services. This is very important to emphasize. And there are several efforts, including our coalition and Know-How Center, to try to reach such kind of data on the national level. And also on the local level, we will continue to push the system to really collect the important data and to run policies and practices based on data, on scientifically collected data and scientifically analyzed data. Next, third finding is the isolation of the sectors make the work with children and families fragmented. What we found in the field is that social services are working separately from each other. And in our practice, we found, for instance, that one and the same boy who is in the system of child protection works with 3 psychologists, one in the school, one in the residential care center, and one in the daycare center. And none of them is connected to the other. Each of these psychologists works something with this child, but it is waste of time, waste of money, and no efficient result of this. So we think that it's very important, the coordination between the services and realization of what is called case management of the cases, because it's very important to have all these professionals that work with the child connected to each other in a very realistic, not only documentary, but active professional way, to share their experience, to share knowledge. And that's why we promote, as Know-How Center and as a coalition, the idea of multidisciplinary work. We are trying to refine now some of the documents of the Ministry of Labor and Social Work, the social support, that are present but not realized yet in the way they expected to be realized. There are some lacks of lack of very important elements in this networking between the institutions and between the professionals, because we found that parents are not included enough in this kind of networking. Their voices and voices of the children are not included. We realized that there is no supervision there. As professionals, we know that when we work with difficult cases, we need a lot of support, and part of the support and development, good standards, require constant, regular supervision of these cases. So we promote this multidisciplinary supervision, multi-institutional supervision in order to prevent separation of children and families. It's very important, and very important for the effectiveness and efficiency of the services that we have. Fourth finding is that the system operates primarily in an emergency mode. We found that most of the cases of children separated from their families are made in emergency when the risk is so high that we have to remove the child physically from the family immediately, because there is a danger for his or her health and life. And this is important to say that in the system of child protection, we have these efforts to prevent such kind of cases of removing children from their families. But they sometimes go to the opposite. When really is needed such kind of separation and the risk is very high, they decided not to take the child. So we have to make the balance in the system, and very good criteria when it's emergent case and we have to do this, and what we are doing with the child and the parents in emergency cases, because we found that no one communicates with the child and the family and prepare them for this kind of separation. And it's very traumatic and painful experience. Some of the services do this because they have good practices, and we will listen today of some examples of these practices from you, but this is not regular thing. The fifth thing is that we need to renovate, we need to refine the documents, the main methodologies and instruments. We found that there is a rich amount of many different measurement instruments, some methodologies used by different services, and it's good to collect this kind of a good experience that is present in the system, and together to develop basic standards how our good practices have to look like. So work with the documents, with the methodologies is also one of the recommendations by the specialists. Social work training for working with children and families does not always lead to the necessary skills. There is a lack of very important skills in the professionals, and this involves usually work with the parents. They share their difficulty to work with some categories of parents. For instance, there are parents that after separation act passively. They don't change. They don't follow the recommendations of the social services what to do. And the child lives in the residential care for a long time because of this. There are also very aggressive parents that doesn't recognize their problems. They don't accept that they have problems, that they created environment that puts the child at risk. There are some points of view that neglect these problems and this kind of connection. For instance, one of the services, one of the specialists said that if we have such kind of aggressive and unaccepting rules parents, we just don't work with them. But I think that the social work is to work with the worst cases, the most difficult cases, the not voluntary clients with that doesn't recognize their need of being supported. So we, with the specialists, we spoke about this in the focus groups, and they shared some of the skills that they lack or they recommend to be developed further, involving and empowering parents, working with parents, informing children and parents. This is very important, actually, when children is separated from its family, to be informed in the right way. Because we found in another research related to the institutionalization process that a lot of services or a lot of specialists, in order to avoid suffering from children, they are lying them that they will stay for a while in this residential care, or they are lying them that this is beautiful place, that they will spend a very nice time there. But to recognize the suffering of the children and to keep alive the relationship between the child and the parents is very important, a skill that needs to be developed very well. And trainings and standards for this are very important. So that's why we emphasize especially this moment of separation, preparation for separation. And after that, we have very beautiful practices in our coalition, working with parents after that, after separation, to keep this tie, this relationship good, and not to neglect or make negative picture about what your parents did, what they think about you. Sometimes some of the services, some of the specialists are not able to handle this situation of suffering of child and suffering of the parents, or doesn't recognize this and neglect this. Seventh is child protection measures are not always sufficiently well thought out. I said about the family needs. Family have to be put in the agenda, and activities in each of these services, social services that we work with, when the separation occurred, or even when we found certain risk for the child. Working with the families is not priority for the services. That's why we collect some of the good practices from our services, from our coalition, that are focused specifically on this recommendation. Children should be involved in decision making, and when there is conflict between professionals and parents, we couldn't make this available to the child, or sometimes they involve even child in this kind of conflicts, one and the other side. So it's very risky and very unhealthy for the children. This is important to have in mind also. And the last one is communication skills are needed for the specialists who work with children and families. And we here selected some of these main skills of communication that have to be developed, and the information that have to be given to the families and to the children. To the families, we have to be given sufficient information about the reasons for taking this measure of separation. What is the removal procedure? One of the specialists said that even parents are not informed that they have to fill in certain documents in order to be able to see their child when it's he or she stays in residential care. And if they are not illiterate or informed enough, they don't know that they have this right to go and see their child, and no one informs them sometimes. So this obligation to inform about all rights of the child, but also all rights of the parents is very important. For instance, in one of the questions that we asked professionals, what are the rights of the parents? Some of them said, we don't care about the rights of the parents, we are protecting the rights of the child. So still is there this conflict and this split between parents and children, and we are like safeguards of the child, but not caring about the main system in which this child grows, parents and its family. So it's very important to change some, not only the skills of communication, but also some of the ideas with which some specialists enter the support field. It's very important to have also work with the discrimination attitudes that we found during our research. This is very shortly said what recommendations of this our colleagues are in this research. Here we give you some other resources in this certain the same topic. Thank you for the attention, and now we can comment on these findings. Thank you very much.